Hi, today I'd like to tell you how you can have fun preventing prostate cancer. And when I say fun, I mean the kind of fun that men love to have. But first the question, why should I or you be bothered about preventing prostate cancer? And the answer is that by the age of 80 years, 80% of the men are at risk of having prostate cancer. But I'm not worried about it. And I don't want you to be worried about it either. And the reason is because I know that I can prevent prostate cancer by doing some simple things which are a lot of fun. And even if it cannot be prevented, detecting it early can cure it more than 90% of the time. So let's start with the prevention bit. What is the kind of stuff that men like to do? Well, the first thing which comes to mind is love, romance, and sex. We love romance and sex because we are very romantic creatures, I've been told. So you will be glad to know that having regular and frequent sex reduces the risk of prostate cancer. Now that is a fun fact. But before you make your next move, please hear me out. Although sex reduces the risk of prostate cancer, sexually transmitted diseases increase the risk. So if by any chance you or your partner have got sexually transmitted disease, you can still have sex, but use barrier contraceptives like condoms and try to get the infection treated. Most of the time, these are curable infections, treatable by simple antibiotics, and you can consult your doctor for that. The second thing which often people ask me is, okay, doctor, I've done the romance, I've done the love bit. Now, what am I going to do in the next 23 hours and 58 minutes to reduce the risk? And the answer is simple. You can do many things, simple things, in your daily activity and diet, which will reduce the risk. So regular exercise, whether you go to the gym or you go for a walk or you go for a run, burning calories is going to reduce the risk of prostate cancer. By the way, having sex also burns calories, and the longer you can have sex, the better it is at reducing prostate cancer. Second thing is diet. What to have in the diet. The general rule of thumb, have 5 portions of fruit and vegetable a day. That will reduce the risk. Similarly, any kind of fruits and vegetables which are high in vitamin E and selenium, that's one of the minerals, reduces the risk of prostate cancer. But once again, I've got a little secret and a little warning for you. Synthetic vitamin E and selenium would not reduce the risk. They would in fact increase the risk of prostate cancer. There are certain diets which are really good for reducing the risk of prostate cancer. And these are diets which are especially rich in selenium and vitamin E. So the diets which are rich in selenium include fish, especially tuna, sardines, halibut and shrimps. And then beef liver, chicken, eggs, and cottage cheese. So all the kind of stuff that men love to eat. However, some men are vegetarian. And in that case, you can try what I call the 3 Bs. The brown bread, brown rice, and baked beans. They would have enough supply of selenium and other nutrients to reduce the risk of prostate cancer. Coming to vitamin E. Vitamin E rich food is easy to get. You have it in olive oil and almonds and almond oils and pine nuts and pistachios. It's also found in some fish like salmon and rainbow trout and cod, and in fruits. Mangoes, kiwi fruit, apricots, and you also have it in turnips. An interesting thing is that tomatoes are a very good source of vitamin E and vitamin C. And having processed tomatoes is linked with a reduced risk of prostate cancer. So if you have cooked tomatoes or have them in the form of pasta sauces and stuff, they will reduce the risk of prostate cancer. And last but not the least, chili powder. Yes, this is a magic ingredient. It has a lot of vitamin E in it and can reduce the risk of prostate cancer. Coming back to diet. There are some dietary things which can increase the risk of prostate cancer, and these are high-calorie diets and dairy products. So cut down on the dairy product and you reduce the risk of prostate cancer. The next question is, how would I know my preventive measures are working? And the answer is screening. Above the age of 50, it is recommended that men should have screening for prostate cancer. And screening is much easier than it used to be. You know, the good old times when doctors would put a glove on their hand and do a back passage examination, the most dreaded digital rectal examination. You don't need it anymore. And if your doctor is insisting on it, feel free to decline. Nowadays, all you need is a blood test known as the PSA test. And if that is abnormal, they can do an MRI scan to look at the prostate without the need of any intrusive physical examinations. However, there's a little secret. When thinking about screening, look at your family history. If you have a family history of cancer, a first-degree relative who's had a prostate cancer, maybe a father or a brother or an uncle, then you should start screening a bit earlier than usual. Usually we recommend whatever age your first-degree relative has had cancer, you should start screening 10 years before that. Similarly, another secret is that there's a rare kind of breast cancer known as BRCA or BRCA mutation breast cancer, which increases the risk of prostate cancer in the male family members. So if one of your close female relatives has a BRCA gene mutation related breast or ovarian cancer, then you need to get screening for prostate cancer at an earlier age. Last but not the least, the very important question. What if a man has had preventive measures and they've had screening and they still end up with prostate cancer? What's going to happen? And the answer is, fortunately, at an early stage, we can cure more than 90% of the prostate cancer. And even those who are not cured, they can have effective treatment and live for a very long time. With the current treatments available, 70% of the patients live beyond 10 years. And this is getting better with the new treatments which are coming in. In fact, one of my patients is alive more than 26 years after having prostate cancer on active treatment and having a very good quality of life. This month is Prostate Cancer Awareness Month. So I'd like to request you to share this information with as many people as you can. And for more information about prostate cancer and cancer in general and how to prevent it, please visit my website, Killing Cancer Kindly with Dr. Khan.